listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static.
In today's episode, there are changes coming to the Affordable Care Act that you and your clients should be preparing for. How the ACA Subsidy cliff impacts clients shopping for marketplace coverage, written by Emily Ryan. Thanks to the American Rescue Plan Act and the Inflation Reduction Act, ARPA and IRA, respectively, and their subsidy expansions for Affordable Care Act, ACA plans, marketplace coverage became much more affordable for many individuals. However, expanded subsidies will expire at the end of 2025, unless updated legislation is passed. If the enhanced ACA subsidies expire, many marketplace shoppers will face the full sticker price of an ACA insurance plan. We'll be exploring who the 2026 ACA subsidy cliff affects and how to help your clients who could be navigating higher costs. First, let's go over what the ACA subsidy cliff is. The phrase 2025 or 2026 ACA subsidy cliff refers to the dramatic drop-off in government financial support through premium tax credits and, in some cases, cost-sharing reductions that will occur after the expansions to marketplace subsidies expire. This is usually called a cliff because of the steep marketplace premium increases that will face individuals who no longer qualify for subsidies. There is no phase-out from subsidized health insurance premiums. The increase could be dramatic based on where an individual lives, how many people are in the household, and the age of the client. How did the ARPA and IRA enhance subsidies? The American Rescue Plan Act of 2021 temporarily expanded ACA subsidies for 2021 and 2022, making them larger for those who already qualified and newly available to certain middle-class individuals. The expansion allowed individuals over 400% of the FPL to receive subsidies to apply to coverage as long as the marketplace coverage costs accounted for more than 8.5% of their annual income. In 2022, the IRA extended the enhanced subsidies through the end of 2025. Who will pay more for ACA coverage after the subsidy cliff? Once someone earns more than 400% above the federal poverty level, they may no longer qualify for subsidized ACA coverage. For 2026 coverage, this would be an individual that earns more than $62,600. A family of four would not qualify if they earn more than $128,600. Unless legislation is passed to continue the expanded subsidies, millions of Americans, almost all subsidized beneficiaries, will have to pay substantially higher premiums for ACA coverage in 2026. To stay up to date, be sure you're following along with the podcast. We post weekly news updates in the Friday 5 and post breaking news episodes to keep you informed. How will the subsidy cliff affect the ACA market? The subsidy cliff will have dramatic effects on the ACA market that will impact all ACA eligibles and could affect your business. If subsidies are not extended, we may see an increase in silver loading. Silver loading allows carriers to increase the premium cost of a silver tier ACA plan to offset the cost of providing cost-sharing reductions to eligible clients. Since subsidies can only be applied to silver tier plans, these are the only plans that get affected by silver loading. Silver loading is permitted as long as the state regulatory bodies agree and carriers do not receive reimbursements for subsidies. Higher Silver Plan premiums could affect those no longer eligible for subsidies much more than those who remain eligible. However, others could be affected as well. Tax credits are calculated by the difference between the second lowest cost Silver Plan and the client's modified adjusted gross income, MAGI. The increase in premium costs could increase the number of subsidies given, resulting in higher government spending. Additionally, if subsidies expire, we will see more pronounced ACA cost differences between states. Without extended subsidies, the difference in costs between states will become much more noticeable to consumers. Individuals in rural areas or in areas with high healthcare costs will experience much higher premium costs. The KFF website has a congressional district map you can view to better understand the premium increases across the country. We'll have that linked in the episode notes for you. KFF states that, quote, 15% of people with individual market insurance who would lose subsidy eligibility live outside of metropolitan areas, compared to 9% of Americans with incomes over 4 times poverty, end quote. In the event that subsidies expire, these customers are likely to turn to purchasing private insurance or a plan off the exchange that is likely much more expensive than marketplace coverage would have been. The last impact, and possibly the biggest, we'll go over today is seeing a higher uninsured rate. In 2025, 24.2 million individuals signed up for ACA coverage through the marketplace. This was the largest enrollment to date. Without extended subsidies, the Congressional Budget Office estimates that there will be 16 million more uninsured individuals by 2034. The office estimates that 4.2 million of those 16 million can be directly attributed to the expiration of extended subsidies. According to their report, 2.2 million individuals will lose coverage in just 1 year after subsidy expiration. There are risks when a significant portion of society goes uninsured. Negative effects to the person, the healthcare system, and the economy. When individuals are uninsured, they may forego accessing healthcare services when necessary, resulting in poor health outcomes. One valuable protection of the ACA is the coverage of preventative health services. Without marketplace coverage, individuals could delay preventative and regular health appointments, potentially worsening chronic conditions. The healthcare system overall may face challenges when less individuals are paying into the system. For instance, hospitals and providers absorb the cost of providing services to those who struggle to afford them. Those who cannot access providers may turn to public health resources, putting an additional strain on those organizations. With higher healthcare costs, the national economy could suffer. That was a lot of information to go over, and not very positive for your clients and your business. But it's a good thing your clients have you in their corner. There are things you can do to help clients prepare and navigate the system. Let's talk about how to prepare and assist clients once subsidies expire. Inform your clients that these changes are coming, especially if they are currently just above 400% of the FPL, or if they are on the cusp of being so. We recommend that before you enroll a client during the open enrollment period, OEP, you properly calculate their MAGI. The IRS website has a great resource to calculate MAGI. You can find the link to that in the episode notes. After calculating a client's MAGI, if there have been any income changes, it's important that your client reports these changes to the marketplace. This could either mean more subsidies for your client, or your client is no longer eligible for subsidized ACA coverage. If your client needs to make a more budget-conscious decision, consider a bronze plan with a lower premium. For clients that are no longer eligible for subsidies, a bronze ACA plan could be a more affordable option than purchasing private insurance or taking the full price of a silver plan. If your client feels they need to supplement their coverage, look for an ancillary dental, vision, and hearing plan, hospital indemnity, critical illness, or other supplemental or complementary policy. There are other options in the case that subsidies expire. Although we don't yet know if the enhanced ACA subsidies from the ARPA and IRA will be expanded again, there are solutions and ways you can better assist your clients. We encourage you to serve your clients by educating them on this potential change, if it may impact them, and then helping them consider all the options that align with their budget. And remember, you're not alone. Here at Ritter Insurance Marketing, our staff is always happy to answer your questions and highlight resources for agents. We offer a variety of ACA carriers that have affordable options in their portfolio. Visit the link in the notes to register with Ritter today to gain access to these contracts, as well as top-tier technology support and a full sales team that is here when you need them. Thank you so much for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Emily Ryan, script proofing by Sarah Ruppel, recording and production by me, Tina Lamoureux, podcast design by Urban Rivera. Rate and review our show on Apple or Spotify.